Umgeni Med, written and directed by Dr. Melissa Jhinku.
Episode 2.
Welcome to Riverside Hospital, a fictional public hospital based in Durban, South Africa.
In a system that seems to be failing its people, we only have the medical team to keep things together, to heal the injured, to save lives. On our last episode, we followed the medical students while they worked a night shift with the cranky Dr. Miller, saved Mr. Mudley's life, met some of the senior doctors, and watched Lily cope with a needle stick injury from an HIV patient.
These lifts are taking so long. By the time they come, visiting hours will be over.
It's only because 1 out of the 4 lifts are working. Yeah, the spicy wings I bought for my husband will get cold too.
Hiya! How you can bring wings for your husband? Don't you know how terrible they are? Don't you have any common sense? Don't you know that grease can clog the blood vessels? No one taught you.
What did you bring?
Only some samosas, vada, and some sweetmeats.
How are you? I can't take the stairs. You know this knee of mine.
Even me. I sprained my ankle.
That's nothing. I had one slip disc.
Yeah, but my husband is on the 6th floor.
Mine is on the 7th floor.
I've got the furthest way to go. My husband is on the 10th floor.
But hey, my husband really needs me. He was almost transferred to the big hospital.
Oh, please. Mine almost went for a surgery.
That is nothing. Mine was almost transferred to ICU.
Hey, auntie, lucky he wasn't transferred to the basement.
What is in the basement?
The morgue.
I just got home now. Yes, I've got my ARVs from the staff clinic. Kiara, how am I going to tell my mother that I got pricked with a needle in the HIV clinic? You know how she can be. Anyway, I'll call you later. Thanks for checking up on me. You're a good friend.
That's the time to come. Why are you so late? You have no consideration for me waiting at home for you.
Sorry, Mom.
You know, I'm so sick and tired of that word from you. Is that what you wore to the clinic today?
Mom, I got stuck in the staff clinic.
Stop mumbling. I can't handle it when you stop and stutter like that.
Mom, something happened today. I got a needle stick injury. The needle had HIV blood on it.
What were you doing that made you so careless? Don't you look when you're taking blood? So, what now?
I have to be on ARVs for a month.
It's your own fault. Gosh, do I have to pay for your meds now? You know, I don't have the time to take you to the clinic.
No, Mom. I got them from the hospital, and the staff clinic is there.
You really have no consideration, Lily. How do you think this makes me feel? How do you expect me to have peace of mind for the next month? And then what? I just don't know how you could do this. Really.
I'm sorry, Mom.
Just leave me alone for now. I need some time to now think about all of this.
Student nurses, does everyone have their ward duties for this morning? Make sure that the pre-op patients are staffed. Please, just check Mr. Lamini. He likes to hide snacks under his pillow, and he will argue with you that pizza is a clear fluid. The ward round will start as soon as Dr. Chetty arrives. Nurses, I know that all of you admire Dr. Singh, but please stop giggling on the ward round. Especially you, student nurse Sam. Is that clear?
Was Dr. Singh on the ward round last night?
Yes, he was on call last night, so he'll be all rugged.
Up all night saving lives?
Shh! Or else Sister Smith will hear us and we'll never let the student nurses go on a ward round with Dr. Singh ever again.
Sorry, he just makes me so...
Ooh, I wouldn't mind him giving me a cardiac exam. Then you will hear how he gives me a 2nd-degree heart block and atrial flutters.
I wouldn't mind him giving me a breast exam. He can search for lumps for as long as he likes.
I want a full body exam. I'll be like, no, Dr. Singh, it's not necessary for you to leave the room when I'm getting undressed.
Ladies, the round is starting. And don't think just because this door is closed that I couldn't hear everything you said.
This is Mr. Mudley, 55-year-old male, presented with a myocardial infarction. He is known hypertensive and diabetic. He's now stable, however his GMs still seem to be elevated. Nursing staff have reported that Mr. Mudley is refusing to take his insulin injections.
Thank you, Dr. Singh. Mr. Mudley, you came in with a heart attack, and your sugars are still high. I thought our student Dr. Daniel counselled you on your conditions.
Oh, yes, he did. But Dr. Chetty, those injections are so painful, eh? And I don't like pain.
Mr. Mudley, we need to get your GMs to be in the normal ranges before we can discharge you. There are patients in casualty who've been sitting there for more than a day now who are waiting for this bed. You're a grown man. I cannot force you to take your treatment, but I cannot have you occupying a hospital bed for this reason. Why don't you have a chat with Mr. Ndlovu next to you about his complications with diabetes, and then you might change your mind about your treatment? Students, can you tell me the acceptable ranges of glucose in a finger prick test? Kiara?
Fasting GMs should be between 4 and 7.
Daniel, what are some of the signs and symptoms of diabetes?
Increased thirst, frequent urination, unexplained weight loss, fatigue, blurred vision, and frequent infections.
Lily, what are the complications of diabetes?
Yes, sorry, I just,
What are you doing? If you aren't going to pay attention on the ward round, there is no point to be here. I'm taking time out of my day to teach you. The least you can do is pay attention. What are the complications of diabetes?
cardiovascular disease.
And such as?
Heart attacks, strokes,
Anything else? Kiara, please. What are the other complications of diabetes?
The small vessel damage can happen in many organs, like in the eye, retinopathy, causing blindness, in the kidneys, causing renal failure. It could lead to nerve damage, such as loss of feeling in the hands and feet. This, along with the difficulty to heal infections, can cause foot injuries to gangrenous. Studies have also shown a link between depression and Alzheimer's.
Thank you, Kiara. Lily, you better do some reading.
This is Mr. Ndlovu. He's a 62-year-old male, uncontrolled diabetic, and he presented last night with a gangrenous right foot and is awaiting amputation.
Yes, I see. Put him on the slate for a below-the-knee amputation.
Doctor, it's just the toes. Please, I beg you. It's only the toes that are black. Just cut off the toes. That's the only thing that's affecting my leg. The toes that are black.
Sir, the infection has spread. If we don't cut it out at the knee, you will become septic. This is a serious situation. It's not something we do lightly.
Please, doctor, do not do this to me. Please, I'm begging you, do not do this to me. You cannot take away the only thing that makes me support my family.
Your employees can't dismiss you. There are laws against that, Mr. Ndlovu.
But do you think that these bosses are scared of the CCMA? No, doctor. I'm begging you. You can't take away my leg.
Mr. Ndlovu, I'm telling you our plan. If you do not agree, we are happy for you to sign a refusal of treatment form. Next patient.
Hello, Mr. Modley. I'm here to take your blood.
Oh, no. I'm like one pincushion for you people. I don't like needles.
No one likes needles. Please, can I have your arm?
Are you doctor or are you student?
I am a student, but I've taken blood many times.
Maybe I wait for real doctor. You know, nice, he take my blood.
We are short on staff today. We have only one doctor for both wards.
Fine, but please, be quick, eh?
Yes, please hold still.
Hey, you're shaking, eh? You sure you know how to take blood?
Could you excuse me for a moment, Mr. Modley? Kiara, I can't do it. After the needle stick injury yesterday, I'm freaked out by needles. Please come and help me.
You know how to take blood. I've seen you take blood from a premature baby with ease. You can do this.
I'm scared, Kiara. My hands are shaking. I can't even pick up the syringe.
Lily, you look pale. What is wrong?
It's stupid, Dr. Singh. I'm just...
Are you nervous because of the needle stick injury yesterday?
Yes, I can't bring myself to...
Hey, it's understandable. I also had that fear after my first needle stick injury. Come, let me help you. I'll stand there while you take the blood.
But you're so busy. It's unnecessary.
It is necessary. We all need support sometimes. Come, you will be more confident after this. You'll see. Trust me.
Healthcare professionals are there to heal their patients, but they also need support. Not everyone is fortunate to have supportive family, supportive friends, and most importantly, supportive colleagues. On the next episode, How will Lily cope with her symptoms from the ARVs? Will Mr. Ndlovu lose his foot? Will we learn more about this mysterious Dr. Singh?